So first of all, what I'd like to do is perhaps give a little bit of background with regards to the motion. This motion has probably been a very long time coming, and I think you would actually need to go back to the June sitting of Tynwald, when there was a debate with regards to Nobles Hospital and the health service. And what happened in that particular sitting was really an uncoordinated attack on the minister. And when I say uncoordinated, it were a vast majority of backbenchers seem to have some serious issues with regards to Nobles and the running of the health service. Now, there were different issues, but I think they all pointed to the same problem, and that was the leadership and the direction of the department. July sitting came around, and very nearly this motion came forward in that sitting. That wasn't to be, and after that we then got together the backbenchers to decide what course of action we could take. We decided at that particular moment we would take an honourable route. We would write to the Chief Minister expressing our concerns and ask for action. Now, I know this letter has actually been available, and I'm actually now going to various people. What I want to do is to make that publicly available, and there are copies of that letter right here. The letter very clearly states our concerns, and it goes much further and beyond with regards to the consultant's letter, colorectal report, and also misleading Parliament. So we presented this letter to Chief Minister, as you can see there, on the 17th of July, shortly after the Tynwald sitting, and we awaited his response. To this date, we have had no official response by the Chief Minister, and therefore, very deeply regret I have put this motion forward so as to have to see action on the floor of Tynwald. So that is actually the background to it. And I just want to make one other point very, very clear. For me, those who know me know I do not criticise lightly. And I had to think long and hard, as I did, I know the other members there, before putting their name to this. So it is a very serious issue. And I just want to make it very clear, this is not about the individual. This is actually about the department, its leadership and its direction. So hopefully that's enough to open, and I'll take questions, field questions.
Can you confirm the 9 people who've signed this letter, please?
Yes, legibility like doctors, isn't it? There's Alf Cannon, Kate Beecroft, Leonard Singer, Brenda Cannell, Howard Quayle, John Horton, Cliff Thomas, Peter Caron, and myself. There are others who have expressed that they support this letter who didn't have an opportunity to actually sign it. We hurriedly did this because we wanted to present it to Chief Minister at the earliest particular moment. And the reason we wanted to do that is also because we'd actually taken on board what Chief Minister had already stated. He had publicly stated that he wanted to have a reshuffle in February. He hinted at a possible reshuffle in the summer, and this here is an opportunity for him to accelerate that while we're in recess and make that happen. So that was another purpose behind that letter, and sadly, I'm afraid there's been no action.
What do you think the chances are that that motion will succeed?
Well, to be honest with you, Adrian, I have no idea until we actually hit the floor of Tynwald. And I would hope all members will respect Tynwald and therefore be reasonable about their decision to make a vote and wait until the debate is over. So do I know? I do not know, but there's a lot of names on there. And will we get the support? We will wait and see. But this is Tynwald, which actually includes all the ministers and the MLCs who all have a vote.
Do you want David Anderson's job?
Well, it's a very good question, because there's obviously been, sadly, an element of dirty politics with regards to this. What I will do now is probably make it very clear with regards to where that has resonated from. I have been very clear since I've been elected. I will do whatever job is necessary, because I want to work with this government, because we are in such a difficult and treacherous position financially. So I have never volunteered for a job. What I have done is I've said I'll do any job that the Chief Minister feels that my skills, my experience and my background will benefit this government.
But you want to be a minister?
I want to actually I want to contribute positively to the running of this government. So if I'm offered a job of a minister, I will do it. Because I don't think they're all difficult jobs. We're all delegated difficult roles. And I think that if you are to make a positive contribution, you have to work with government, and one of those jobs obviously is a minister.
Can I take you back? Because the Chief Minister said he'd received this letter when I broke this news, and he was going to talk to you. You confirm one more time, you haven't actually had a meeting with him following the letter? Is that what you said?
No, I didn't say that. We have, actually. We never gained a response. And then we requested a meeting. Chief Minister, I think, went away on holiday, and we requested a meeting after that. And we sat down, led a delegation of members of this letter. And we did have a meeting with him. And at that meeting, we had an assurance that he would deal with this matter by end of summer, which once again is the reason for this motion, because it hasn't been dealt with.
So is it more about bringing it to the floor of Tynwald than actually getting through the vote of no confidence? Is it more about opening debate?
Well, I think it's a very good point. Yes, it is. It's about the debate, the future of the health service. And it's quite interesting, really, because what have we seen these last few months is we've seen a phenomenal amount of press releases by the department. But the one that really stands out for me is the one that didn't come from the department, but actually by the Chief Minister. And in that he made a statement there where he wanted to see a national debate about the future of our health department. And that, if nothing else, regardless of the vote, we will have that debate now. It should have been on the floor of Tynwald long ago by the Minister. Sadly, it hasn't, but now it will happen.
Mm-hmm. And so, of course, there's 8 other signatories. Do you think you still have their support?
Well, that's up to them. You know, I think as...
You must have spoken to them.
Well, of course we spoke to them. I haven't seen many of them throughout the last few weeks of summer. However, it's up to them. They've signed this letter. They've obviously had their own reasons for that. And I think that's very important to recognise. We've all got our own reasons for actually signing this particular letter. This is not a personal issue. You can see you've got a massive issue with regards to the public confidence. And one other thing I would point out, this motion is actually put down for the good, hard-working, well-intentioned people that work at Nobles and the health service, because there's been a lot of talk with regards to low morale. Low morale has been around a very long time in this department because they haven't been heard. They say management won't listen. And we are hearing that as certainly the elected officials, and I know some of the MLCs are as well.
Does changing the political leadership actually make any difference to how these problems are dealt with?
Well, the political leadership sets the strategy. And you've got here, we've talked about this time and time again with regards to this rebalancing. You've got the second biggest spending department here. And is it going in the right direction? We've got all these issues that have been raised, and I'm afraid it is time for a change of direction, time for a change of leadership, and obviously a review of that strategy. And this is where the debate is so necessary.
Do you think by tabling this motion that you've actually scuppered your chances of getting a ministerial job?
To be honest with you, Adrian, that doesn't come to mind whatsoever for me. I'm quite happy doing what I'm doing. I believe I'm already positively contributing in the roles that I've undertaken. It's not about being personal ambition. This is actually about the future of the Isle of Man and its health service. Very emotive issue is the health service. And I think, we always got to be very careful with regards to always throwing money at this issue. But you've got to look at, we need a root and branch review of the strategy and the operational issue and the patient outcomes of our people going through our health service.
Why are you not sitting here with all the other people who signed this letter? Why are you by yourself here today?
Well, I put the motion forward. I've accepted the option to put this motion forward because I feel very strongly. The others, I think you need to speak to them individually and ask what their views are. Because as I said to you before, we've all got separate issues with regards to the running and the operation and the leadership of the health department. So I would suggest you actually speak to them directly.
The Chief Minister made it clear, though, he's not happy with any of this going on like this. I mean, it's going on from Adrian's point. You are seen as a high flyer. You do so much in front of the cameras for us all the time. You are fast tracking yourself to be a minister possibly on the reshuffle. Surely this has completely taken that out of the picture. There's no way Alan Bell is going to be able to work with you now, surely.
It's up to him, at the end of the day. I think we're meant to be working together. We're all in this together, really. But he did also say he's also disappointed with a number of issues with the health department. He's been up there a number of times throughout the summer, and it'll be interesting to hear what his views will be when he comes to the floor at Tynwald in a couple of weeks' time.
Can I flip that around? Are you perhaps, I ask you, are you doing this to kind of, becomes your issue, this is what you want to do to make a name for yourself for when you become a minister, or if you become a minister?
Well, no, as I said to you before, when I opened this up, I do not criticise lightly. I have adopted a proactive approach to politics, and I believe that would stand up, and if you look at the track record of where I am. This is such a serious issue that's why I've put the table the motion. However, if it's not me, there's any one number of people that could be sitting right here answering those very same questions. And I think I would be prudent, for you, the media, to actually speak to them. And one other person I'd strongly recommend you talk to is the Bishop. The Bishop, if you recall, volunteered himself to hear from individuals who had issues with the health service and the health department. So we haven't heard from the Bishop at this stage, and it'd be well worth a while to follow that one up.
But this isn't the first time someone's tried to raise a motion like this. Of course, we saw Kate Beecroft do something similar. What's changed between when she tried and now?
Well, the letter, I would think. Kate Beecroft...
But surely everyone who signed the letter had the same opinion when Kate Beecroft raised it.
Well, no, we all wanted to hear what Kate Beecroft said. If you recall what happened in that July Tynwald, many of us were aware that this motion was coming forward. It was an emergency motion, needed a number, 4 members to stand up. And for a vast majority of those people on that letter there wanted to hear what Kate Beecroft had to say before casting a judgment. It goes back to that June Tynwald, where we all discovered, as backbenchers, uncoordinated, that we had a lot of different issues regarding the running of this department, but they all pointed to the same problem.
You've crunched your numbers. Obviously, you wouldn't be doing this if you haven't. Do you think, therefore, you have got a quorum to get this through?
I really couldn't comment on that, Paul. I really couldn't, because I have no idea, and they're all obviously free agents to make that vote. And I would hope the whole of Tynwald, as a parliament, will have that free vote as well. Because the expressions and what has been actually said by members, there is deeper concern beyond those members that have signed that letter.
So you're basically saying Coman will obviously be forced into a block vote?
It's up to that. It's up to Chief to whether he wishes to treat this as a Coman issue or a parliamentary issue.
Coman always block vote, don't they? I mean, that's their nature. They're told to block vote.
Well, I do not know that. I'm not part of Coman, so I couldn't possibly comment.
Well, it's the perception.
Perception, yes. But I know there is deeper concern beyond those people that you see in that particular letter there.
How was the decision taken among the backbenchers for the motion to be in your name?
I was asked by a number of backbenchers, would I be prepared to do it? And we weren't. It wasn't everyone in attendance, I will point out, but there was a meeting with the majority of the people on that letter as to what are we going to do. End of summer has arrived, and I really strongly say this. we feel compelled to do this because we've had no response. I'm deeply regret it, and I once more deeply regret it being in the minister's name, but the structure of government does not allow anything else.
But why you rather than any of the other signatories?
Well, as I say, I was asked to do it, and quite frankly, when I put my name to something like this, and you go back to what job I would do, if I put my name to this, I'm prepared to do something about it. That's how strongly I feel.
Were others asked to do it?
No, I'm not sure. We just had a meeting. I was asked to do it, and I accepted it. It was literally as plain and simple as that, Adrian.
Who asked you?
Sorry, several of the members on there, and it was, yes, it was. It was.
Would you?
My suggestion is to speak to those now that it's virtually.
I'm sure we will, but are you willing to say who?
I don't think it's fair for me to talk about other members there. You've got 9 names on there, and there are others who didn't have an opportunity to sign that, who I would suggest you also speak to.
You clearly indicating you could only go for Mr. Anderson, but you want the people running the shop to go, don't you? I mean, he's just the figurehead at the end of the day. He's the one that has to say things in Tynwald, but clearly if he has misled the House, it wasn't he that wrote all that information. It was given to him by his people.
Yeah, there is obviously a standing committee which you referred him to, and I think that's very admirable, to be quite frank. However, that's a separate issue. It is an important and obviously a serious issue without a shadow of a doubt. However, I would treat that as a separate issue.
But you would want the management people to go, surely, therefore you indicated that to us.
Well, we are concerned. We need a root and branch review. There's no doubt about that.
You say this isn't a personal matter. So is then Mr. Anderson purely a figurehead or a scapegoat?
Sadly, but I think you do have to take a step back and think, well, Mr. Anderson has been the health minister for the last 4 years, and ultimately and legally, the minister is responsible. The minister is the department. The minister is that figurehead. As sad as it is, I once more reiterate, I have no personal axe to grind with Mr. Anderson whatsoever. I really don't, or as members. So, but I do think that we have to, this is a serious issue, and it does lie with the direction and the leadership, and that's why the motion is there.
If this fails to go through, will you keep going, bring it back, or is this your kind of one chance?
Well, it's an opportunity, I think, to raise it. It will obviously have a political debate. There is a public debate that is going on as well at the same time, and you will hear on the floor of Tynwald what the members' views are. So if this fails, it fails. And that's it. If I'm not mistaken, I don't think any vote of no confidence has ever succeeded, as far as I'm aware. So, the track record speaks for itself. But what we will have, as Chief Minister wanted, a national debate on the future of our health department.
Okay, so what I wanted to ask was the state of the NHS in general in the UK is a bit of a mess at the moment. Hospitals are failing standards. You see it in the news every day. Do you think this is Mr. Anderson's fault?
It's a very good question, actually, and I think we've already got. We're talking about patient care here, and I think that's it's a motive issue without a shadow of a doubt. And the issue is that we've got a lot of people have all around the Isle of Man have got anecdotal messages with regards to good service, bad service. What we don't have is real evidence now. Finally, because of political pressure, we now have an independent review that's actually being conducted, or rather about to be conducted. And that's what we've never had on this island, to be able to answer that question as to where do we measure with regards to it, rather than that anecdotal information. So this will provide the evidence to say, is our hospital performing well? And there are a fantastic number of stories that says it is, but there's also equally a lot of other stories. And I think you also need to take into context the one thing that is measurable is the number of complaints. And if you look back the last 5 years, they have been receiving complaints the best part of 1 every other day. So that's the only measurement we've currently got.
But is that the minister's fault?
Is that, well, once more, the minister is the department, therefore is responsible.
And just because I missed the first bit, just tell me what exactly you're trying to do.
Well, there's a motion put forward. I gave a little bit of background with regards to why that happened, and this motion's been a long time coming. It started in the June Tynwald when it was revealed, when we had a debate, that many of the members had a number of issues with regards to the health department, its running, its leadership, its direction, and that then culminated in a nearly happening a vote of no confidence in July. That failed. A letter was then composed, given to Chief Minister directly after that, to take the honourable route, and that is to ask for the Chief Minister to consider his reshuffle, or rather accelerate his reshuffle through the summer. And because we've had no official response from that, that's why the motion is before Tynwald this sitting.
Okay. And I just heard you say as well, none of these have ever gone through before. Is that?
I believe so. So I've been told. I haven't done the research myself, but I understand that's correct.